And, it's important, I think, that people hear that, because I can't tell you how many patients I've met who tell me I'm just pre-diabetic, and they seem to think that in itself is enough, and we don't need to talk about it any further. But pre-diabetes, you just said 88 million Americans, 88 million Americans have pre-diabetes.
And the majority don't even know that they have pre-diabetes.
That is astounding. And it's good. It's good to know that we need to talk about this, guys, because you know what? There are not 88 million Black people in America, which means it's not just a disease of Black people.
Right.
So who are the people who seem to be at risk for developing pre-diabetes and ultimately diabetic? Because the truth is, every diabetic was, except for type 1, every type 2 diabetic was probably a pre-diabetic at some point.
Definitely. I mean, I have some patients who come in who might have had surgery or some other issue going on, and they find out they have diabetes because they were in a hospital and someone was checking their blood sugars. So a lot of us don't even know what's going on with our own bodies. So in terms of the risk factors for pre-diabetes or diabetes, age is a big one. So anyone over the age of 45 should really be screened for diabetes.
How often?
I would say at least once a year with their annual physical. Yeah. Okay. If you have a family history of type 2 diabetes, you are at a very high risk. If one parent has diabetes, you have a 25% chance, which means a 1 in 4 chance of getting diabetes. If both your mother and your father have it, you have a 1 in 2 chance. So 50% chance of getting diabetes. So genetics is super important. Obesity, being overweight or obese will increase your risk. We talked about insulin earlier. Yes. So one of the reasons why insulin doesn't work is called insulin resistance. Mm-hmm. And obesity or being overweight is what leads to that insulin resistance. That's a big risk factor. Being sedentary, not exercising, your diet, if your diet, all the white stuff, white bread, flour stuff, sweets. I tell my patients, have it in my crackers, pretzels, potato chips, all the pasta, rice, bread, all those tasty things that make us feel happy. Yes. Those are the things that are going to really raise your blood sugars. Mm-hmm. Mm-hmm. And also diabetes is also linked to other coexisting conditions like hypertension, high cholesterol. They kind of cluster in one individual. That's why these people who are dying, I'm sure that they just don't have diabetes. They probably have diabetes as well as hypertension, as well as obesity.
Yes, as well as heart disease, because a lot of people don't realize that diabetes and heart disease go together.
Yes. Heart disease is one of the number one ways that people who have diabetes die. They have massive heart attacks. Yeah.
Yes. And I think a lot of people don't realize that. And so, unfortunately, there's so many conspiracy theories circulating right now, as well as it relates to COVID-19 and cause of death. And, people don't understand how cause of death is determined, that there's a lot of misinformation and thus misreporting of cause of death as it relates to COVID-19. But yes, somebody with diabetes who has COVID-19 can die from a heart attack in the hospital. And that is in fact what is happening. A lot of people with COVID-19, the ultimate thing that causes their death is heart failure, cardiac arrest. Mm-hmm. Mm-hmm. So it's important to know that, guys. It's also important to know that the number one cause of death across the world in men and women is heart disease. But you can have heart disease and also have diabetes. You can have heart disease and also have high blood pressure. So Dr. Kelly, given that, if someone is sitting right now listening to this and they're like, yeah, I'm healthy, but mom and dad have diabetes, should they wait till they're 45 to get checked?
Most primary care doctors would be willing to add an A1C in. Yes. The guideline says over 45, you have a higher risk. We also do once a year, some physicians also check a complete metabolic panel, and they ask you to do it fasting, and included in that panel is a fasting blood sugar. So that's a good way to see where you're at. So if you know that both of your parents had diabetes, like I said, you have a 1 in 2 chance of also getting diabetes. Yes. But there's some things that you can do before that happens.
Yes.
We recommend that you have at least 150 minutes of exercise every week. That's like half an hour, 5 days a week at a minimum. Mm-hmm. That's for everyone. family history or not. Everyone needs to be moving. I know it's a little bit harder now with the whole social distancing, but go to a park and still maintain that 6 feet distance. You can put something on your TV or on a computer and just stay active. Also, watching what you're eating, cutting down the amount of carbohydrates in your diet. I know as Caribbean people, we like our sugar cakes and our sweet bread, coconut bread, and all of that stuff. And I tell my patients, we need to be realistic. I don't want people are trying different diets like keto diet and paleo diet. And, I'm all for a healthy diet that you can maintain.
Yes.
A lot of people go on these crash diets, and then when they stop, they gain everything back plus more.
Right.
So I'm realistic. I'm not telling you can never have a slice of coconut bread ever again in your entire life, but don't have one every single night.
Right.
That's what I usually tell my patients. So main things would be, exercise, diet, maintaining a healthy weight. If you do have high blood pressure, also working on cutting down the amount of salt in your food, watching your cholesterol as well, because those usually cluster. Cholesterol, blood pressure, and diabetes cluster in the same individual. So reducing all of those risk factors.
Right. And, speaking of risk factors, given as a reproductive endocrinologist, there's one other key group of young patients who are increased risk for prediabetes and diabetes, and that's women with polycystic ovarian syndrome, or PCOS. Mm-hmm. And for a lot of young women with PCOS, they've never been told about the things that don't relate to infertility, because for most young women, they find out about PCOS in the course of trying to conceive. And then once they've had their babies, they believe their PCOS issue is no longer a function. But the truth is, PCOS is one of the groups we really want to know about when we're thinking about long-term risk reduction for diabetes, cholesterol, and high blood pressure, no?
Yes. I mean, the majority of patients that I see with PCOS are overweight or obese. In terms of why this happens, there's different theories around this, but part of the whole disease process is insulin resistance.
Exactly.
So it all goes back to what we talk about. So a lot of my patients who I treat for this condition, I have them on metformin. Mm-hmm. Metformin can sometimes bring the periods back. If they also have coexisting issues with blood sugars, it helps to reduce their blood sugars as well. A lot of these patients have acanthosis nigricans. Yeah. So people say, oh, the back of my neck is dirty. I thought it was the soap. I was like, no, it's not the soap. Yes. That's a clinical sign that you have insulin resistance.
Yes. And let's talk about that, because acanthosis nigricans is a term that I see circulating on a lot of social media posts, which on the one hand, I'm really excited to see, because it means people are aware of it, but I also then see it associated with some misinformation, right? So acanthosis nigricans, for those who are listening, is that sort of darkening that you see on the back of the neck. It almost looks like it's an accumulation of dirt or miscoloration.
It's also leathery, a little bit
leathery and velvety looking. Okay. And so a lot of people have acanthosis nigricans, and they're hearing one thing or another, and they're actually being told, you know what, if you have that, just go ahead and use some herbs. I've seen quite a few herbal posts, which is go ahead and drink some celery, drink some cinnamon, eat more okra, drink soursop leaves. And I know I'm going down the list because I've received them all, or I've actually had my own family members who, sent me these and saying, Cindy, you're missing out on key information. And so I appreciate everyone sending me. I would say this, particularly in communities of color, okra is a huge part of our diet, and it's been a part of our diet forever. If that was all that was needed to cure diabetes or to prevent prediabetes, people in the Southern Caribbean, West Africa, and the Southern United States would actually have lower rates of diabetes, not higher.
Agreed with you.
Yeah. I think it's unfortunate that somehow that got lost in the messaging.
Yes. I'd never heard about the okra, so thank you for educating me today. I've heard about cinnamon before. There's some other stuff that Dr. Oz had on his show. I forgot what it's called, moringa. Moringa
is blood, so is chromium. I like to tell patients, listen, like I mentioned earlier to Dr. Kelly once when we were talking, I have 10 packs of frozen okra in my freezer. I'm not here to tell you don't eat okra. We're both from the Southern Caribbean. We appreciate a good callaloo, which has okra in it. We appreciate it. We know it. But I also will be doing you a disservice, and we'll both be doing a disservice to the oath that we took to do no harm if we told you today that okra was going to solve your prediabetes or your diabetes. You can eat your okra, absolutely, but don't do it instead of exercise. Don't do it instead of medications. Don't do it instead of a healthy diet. Right, Dr. Kelly?
Definitely. I mean, okra is great for you. I'm not saying not to have it, but have that as part of a healthy diet. I have patients who stop their own medication without even consulting their physicians because they're trying more cinnamon or they're adjusting their stuff. Like, please don't do that, especially not now.
Yeah.
Any changes you make in your medicines, please run it by your physician.
Speaking of cinnamon, when I was in fellowship, we actually had someone who came in and showed us how much cinnamon you need to take per day to be the equivalent to 1 tablet of metformin. Mind you, most people need to be on 2 to 4 tablets of metformin a day. And it was a whole cup full of cinnamon. Can you imagine what that would taste like if you had not a water flavored with cinnamon? I mean, a cup full of cinnamon powder like this. That's how much you would need to start being equivalent to 1 tablet of, say, metformin or glucophage, a 500 milligram tablet. And I think it's important that people hear this because, again, I love my cinnamon. We put cinnamon in so many things, our tarts, our puddings, our right, the sweetbreads and the sugar cakes that Dr. Kelly just referred to. Cinnamon is in all of that, but you wouldn't possibly be able to eat or drink enough cinnamon, even if it were made into a tablet, to be healthy and safe enough to bring your blood sugars down. So moringa is another one. Moringa is an interesting herb because it's now become the herb to treat all things, the magic herb. And again, we have moringa plants on my veranda, on my porch. I have a moringa plant. Is if moringa lowers blood, maybe it lowers it 5 points or so. But when we talk about hypertension, what are we talking about, Dr. Kelly? When we tell somebody they have high blood pressure, what are you talking about?
So some people say I have a little bit of pressure. A little bit of sugar. There's no such thing, a little bit of pressure, a little bit of sugar. So I believe it's when your blood sugar is over. Well, when you have diabetes, our goal is for you to be under 140 over 90. Yes. But hypertension, anything higher than 120 over 80, you consider to be hypertensive. Yes.
And so that's important too, because I think a lot of people think high blood pressure is when your blood pressures are 180, 200, right? As long as under 100, you're okay. But the truth is, it has a lot more nuance, and like you're saying, the bottom number needs to be under 80 or under, ideally.
Yes.
And the top number needs to be 120 or under, ideally.
Yes.
So if you're somebody with a number definitely above 130 for your top number, you should be talking to your doctor. And especially if your bottom number is 90 or higher, you should be talking to your doctor, correct?
Correct. Yes. So, I mean, as a diabetes specialist, those are the things that I look at when I see a patient. Even though their primary care might be managing their blood pressure, it's still part of the questions that we go through just to make sure, because diabetes is a risk factor for heart disease, so is hypertension, so is high cholesterol. So we have to make sure that we're treating all of these conditions in the patients.
Yes. And, Dr. Kelly, I'm glad you brought that up because you're really referring to what we call the holistic patient approach. And unfortunately, a lot of patients don't realize that medical doctors do holistic treatments and approaches. But especially as a hormone specialist, an endocrinologist, that is important because hormones are in every part of the body. And so every part of your body can be impacted by your hormone imbalance.
Definitely. Even something like smoking, I could get someone's A1C under 7%. That's the goal when you have diabetes, by the way. But if they're still smoking, they still have a very high risk of having heart disease. So we ask those questions at each and every visit. Are you still smoking? Do you want me to refer you to somewhere so we can work to help you to get off the cigarettes? And even though with coronavirus, I saw a recent article thinking that vaping and smoking, even weed,
Yes.
Increase your risk of having, complications from coronavirus.
Absolutely. And, it makes sense that it would, but that's why I'm glad we're talking about this today, because I think a lot of patients and people listening don't realize how these things go together.